First case of the day is a boisterous 4-month-old Labradoodle called Murphy.
He's come to the small animal hospital this morning to find out about some malfunction with his liver.
Murphy recently ate a piece of his own basket, and during an operation at his own vet's to remove it, they found a problem with his liver.
Hi there, Rory Bell's my name.
Worried owners Bill and Wilma Malcolm hope that senior clinician Rory Bell can help.
Am I going to have to examine you upside down? Yeah, what I'm doing now is just giving him a clinical exam, looking for really any abnormalities. Isn't that right, Murph? And you think this is a game, don't you? You're much more interested in trying to chew things, aren't you? OK, clinically, he looks like a normal, healthy pup.
Yeah.
The problem is we know that his outward appearance is a little bit deceptive, and he does indeed have a liver that's not working properly. He probably has an abnormal routing of blood through or around his liver. Some dogs have what's known as a portosystemic shunt. That's the name given to this abnormal blood vessel or blood vessels. And as a consequence of this, some of the blood from the intestines bypasses the liver, and that blood containing all the toxins that should normally be extracted and dealt with by the liver gets through into his circulation.
This is a serious condition, especially in a young dog. The abnormal blood vessel will affect his growth and development, leaving him vulnerable to infections. If left untreated, the condition could lead to seizures and fatal brain dysfunction.
The pros and cons of surgery versus medicine really depend on what type of shunt it is. Medical management is an option for any type of shunt, but some types of shunt have the option of being managed surgically as well.
Yeah.
Right, okay guys?
Okay, thanks.
Surgery would give Murphy the best possible chance in the long term, but before they can operate, they need to find the abnormal blood vessel. And in a dog this young, that is going to be far from easy. In the imaging department, Murphy, a 4-month-old Labradoodle, is having an ultrasound scan to look for a shunt, an abnormal blood vessel to his liver. Ultrasound is the quickest and least invasive way to investigate the problem. However, it's a very tricky procedure in a dog this young.
It's difficult because, for starters, we don't know if the vessels are there. We don't know where they are. And even if they are there, they are going to be very small and therefore difficult to see in a dog of this size.
There's a little bit of thing going in there. You can sometimes pick things up.
For the ultrasound team, it's a painstaking process.
The words needle and haystack would sort of begin to describe what Gawain and Monica are trying to do. Or should we have another look with the ultrasound? It's up to you.
I can't find an obvious one there, but
Yeah.
the two of the more likely areas, unfortunately, we can't see.
Yep. Unfortunately, his stomach was quite full of food, which means it was very difficult to see some areas around the liver. So what we're going to do is try tomorrow, and hopefully his stomach is a little bit empty. Have another look then, and we'll see how we go.
With the scan inconclusive, they can't go ahead with the surgery. Murphy will now stay at the hospital overnight. And for Wilma and Bill, the worry intensifies.
Well, I think the way he was talking, you know, it could lead on, obviously if your liver's not working, it could lead on to other things. And I'm just glad we've been referred up here. But the house will be really empty when I go home.
In the small animal hospital, Murphy the Labradoodle is being sedated before his second ultrasound scan.
Oh dear, that's it.
Vet Rory suspects that he has an abnormal blood vessel in his liver, which means the toxins in his bloodstream could make him very ill indeed.
What we need to do is look at the very complicated network of blood vessels that surrounds the liver and try to identify from all those blood vessels one or more abnormal vessels.
Going forwards, we're going into liver. That's it there.
Finding the abnormal blood vessel or shunt isn't going to be easy. But with Murphy's stomach now empty, diagnostic imager Dr. Alison King stands a far better chance of success.
But usually when you get a big S shape like this, it's not normal. So that's the S for shunt. This is the S here. So what we have is in essence two vessels running along side by side, and instead of them being completely separate, there's just a communication between them. So that all the blood, instead of going straight forward into the liver, is getting shunted down into this, the caudal vena cava. And there's not very much going forward. There's some going forward into the liver, because he still has a reasonably sized liver, but not as much as it should be.
Well found.
Yeah,
Very
well
good
done.
find. Yeah.
With the shunt located, surgery is now an option. But it's far from risk-free. Murphy's owners now face a difficult decision.
Yeah, he's just grousing. It's a combination of the fact that he's bored and also the sedatives he's had will have some sort of dissociative effect, so he'll probably be a bit disorientated. But it's mainly just a young dog grousing because he's bored. It's you. Yes.
In the dog ward, Murphy is recovering after his second ultrasound scan. His owners Bill and Wilma have been very worried, and now Rory can update them.
Hi guys. I just wanted to talk to you first without Murphy because he's probably going to go berserk when he sees you, so we have a calmer experience without him being around. We found this abnormal vessel. It's been there since he was born. Okay, so this is something he was born with. The problem is that over time, his growth is going to outstrip his liver.
There are now two ways forward. Medical management, which involves Murphy going on a course of drugs, or they could choose surgery.
The medical management is sort of low risk in the short term, but long term not as good, whereas surgery is much higher risk in the short term, but potentially long term a better outcome.
So there's pros and cons in both sides.
There are pros and cons. If he were my dog, then I would seriously consider the surgery.
I think that's the way we were thinking that anyway, because it sounds as if it's a permanent.
If it works.
Yes.
And that's the if.
But for now, it's all about reunions.
Do you remember us?
I think our job as clinicians in this situation is to try to give Murphy's owners all the information they need so that whatever decision they do make is one that they feel comfortable with.
Murphy's been put on a course of drugs to reduce the toxins in his bloodstream. And for now, Wilma and Bill can take him home to consider their options.
I wish there hadn't been anything wrong with him and we wouldn't change him for the world. But the vet did say that of all the diseases he could have affecting his liver, this is the most treatable and there's something they can probably do for it, so we're quite relieved about that.
Murphy needs treatment soon. It's not going to be an easy decision. Murphy, the Labradoodle pup, is back in the small animal hospital. His owners have decided to go ahead with the shunt surgery to close off the abnormal blood vessel near his liver. It's a tricky operation and will be performed by head of surgery, Catherine Pratchka.
What we aim to do with surgery is to put a device, the amyloid constrictor, which is what I'm going to use, around that anomalous vessel that will gradually close it off over the course of the next couple of weeks. So the blood flow is gradually diverted back into normal pathways and it allows time for him to adapt to it. So it's kind of a gentler approach and therefore safer.
Murphy's operation is an unusual one, so Catherine's students are keen to watch.
So the first place for an extrahepatic shunt to check is in front of, this is the celiac artery, this one that sort of curves up.
First, Catherine must find Murphy's shunt.
By definition, any vessel that you find at this level is a shunt. There it is. So you kind of slightly have to, it's huge, oh my God, that is an enormous vessel. That's absolutely massive. It's easily the diameter of one of my fingers, maybe more.
Catherine must now apply the aneroid constrictor. It's a delicate procedure.
The abnormal vessels are usually thin-walled, they're quite weak, and you can, if you're not careful, poke a hole in them, which is clearly going to cause you fairly significant problems. Yeah, so that's sitting in quite nicely there, sitting in quite comfortably.
The constrictor, over time, will shrink and close off the blood vessel and stop it from pumping toxins into Murphy's body.
I think the surgery went nicely. Over time, they can progress to certain irreversible changes. He doesn't have any sign of those, so that's good. It means everything is still hopefully at the point where it can be sort of reversed and he can return more towards normal.
The operation has gone well, but the threat of complications is at its greatest just after surgery. Now Murphy will need to be monitored closely until they're confident the operation has been a success. And in the small animal hospital, Murphy is ready too. He's recovered well from the operation to close a shunt near his liver. And now owners Wilma and Bill can take him home.
A good boy?
Yeah.
Oh, you're gorgeous.
See you in 8 weeks.
Yes.
To see how is he doing.
Because this place is so good, we had every faith in it working out well, but we were obviously anxious to see him for ourselves, so we're delighted to have him back. I think he'll just go straight back home and cause havoc again.
Where's Mum? Murphy. Murphy, where is she? Where's Mum? Look, there she is. You see her? You see her? Who's that? There she is. There's Mum. Get him to walk on.
Murphy, come. Bye-bye. Wheels away. Wheels away. Come on.
He's not doing it right.
I'll get it. Dad will need knee pads to go down the floor.
Murphy! Murphy, come!
Murphy, come!
Murphy, come!
Murphy!
Here he comes. Come on! Come on! Come on! Come on, what's Neil got? What's Neil got? What's Neil got? Just let him put his teeth through in it.
Sit.
Good boy!
Aye.
Come on, Murphy! Murphy, come! Come! Come on! Come on, come! Ooh, sausage! That was good. We'll do that on YouTube.
Good boy.
Ready? Have another go?
Is that, no, it's not too much in the dark, is it?
No?
safety forward is fine, but just stick it there, man.